Hello and welcome. My name is Ron Getzel. I'm a senior scientist at the Johns Hopkins Bloomberg School of Public Health and also the president and CEO of the Health Project. This webinar is going to give you some insights and guidance on how to apply for and win the C. Everett Koop National Health Awards. The awards, of course, are named after and honor Dr. C. Everett Koop, former Surgeon General under the Ronald Reagan administration during the 1980s. Our mission, which has evolved over the 30 years that we've been around, is to define, promote, and increase the adoption of organizational health and well-being practices that translate into measurable operational impact. Our vision is to promote these evidence-based health and well-being practices to demonstrate how a high-performing, healthy workforce drives organizations, communities, and nations to thrive. Our purpose is to identify and advance these strategies to amplify the value of workforce health and community health and well-being. To be recognized, a program must employ comprehensive and evidence-based strategies designed to improve the health and well-being of the entire population and across the health continuum, from people who are well to those who are sick. Program needs to have been in place for a minimum of 3 years and be well integrated into the organization's infrastructure and yield significant improvements in population health and noteworthy business results. The application must answer these 3 questions. What was done? Did it work? And was it worth it? The judging is weighed heavily, 60%, on documenting health and business outcomes. This is our website, www.thehealthproject.com. On the website, you'll see a button there for the application itself, which you can download. We also have on the website webinars featuring winners and their experience completing the application, applications of award winners dating back to the 1990s, in fact, 1994, when we first started awarding the KOOP Award. This year's application due date is May 31, 2024. However, we are providing a quality control check for organizations that submit applications by May 17, and they can request a quality control check, which will be provided. Here are some of our past winners. You can see a who's who of Fortune 500 companies, as well as some smaller organizations, some with under 500 employees, and some nonprofits, including universities. Recognition is provided each year. The Health Project's Leadership Winning Forum, the Hero Forum, which this year will be in Baltimore in October. And here are pictures of last year's winners, DTE Energy and Idaho National Laboratory. A little bit of background. The program itself needs to be described in terms of its leadership, commitment, organizational culture, strategic planning, communications, intervention components, integration into benefit design, program coordination, and of course, data management and evaluation. It needs to be a comprehensive approach to program design, and the programs needs to be integrated into the organization's infrastructure, its vision, mission, and purpose, and be aligned with broader organizational company business goals and values. The methodology on evaluation needs to be rigorous, and the results need to be well documented. So we're looking for population health management strategies, top health issues that address evidence of health improvement, credible program evaluation methodology and results, highlighting the connection between specific program elements and measurable outcomes. We're looking for documentation of improved health and risk reduction, and the value for investing in employee health and well-being can be demonstrated through medical savings, reduced absenteeism, increased worker productivity, improved attraction, retention of talent, and job satisfaction. We're looking for specifics, numbers, ends of the eligibles, participants, subpopulations, and cohorts. Those are people who are followed over time. Again, the ends clearly labeled in charts and graphs. We're also looking for innovation, new things, new approaches, ways to reach hard-to-reach populations, things that have been tried and are creative and interesting and fun. So here's how you apply. The applications are due May 31 this year. Each application is independently reviewed and scored by 10 to 15 expert reviewers independently. And these reviewers are industry experts, both in terms of program design and implementation, as well as evaluation. The final determination of winners and honorable mentions is made at the board meeting that follows the independent review of the applications, and positive reviewer feedback is made public and can be found on the website so that ideas and lessons learned from these positive applications can be shared with others. Here are some questions we've received over the years. Is there an application submission fee? And the answer is no, it's absolutely free. What you do get for this free application is feedback, a lot of feedback from the reviewers, both positive and areas that require improvement. Will the information reported and submitted in the application be kept private and confidential, not shared with any members of the public? The answer is the winner applications are posted along with the positive feedback provided by the reviewers. The other applications are not made public. When will the winners be notified and when will the winners be announced? Winners are notified in August, and public announcements and press releases are made in September. Is there a common source available or recommendation provided to applicants regarding independent third-party evaluation assistance on preparing and documenting the economic value of these programs? The answer is no. You need to complete the applications on your own as an organization, although consultants and vendors and third parties can help. Finally, what are the rules for reusing content from previous applications in the current application, specifically regarding the description about the organization and its program? Well, if nothing substantial has changed, then you can certainly reuse proper content. However, you may wish to highlight new developments, new things that you've introduced into the program design and implementation. And of course, you need to report the most current data. If you have any more questions, you can send them to our website, and our email address is info@thehealthproject.com. And thank you so much for paying attention to this presentation, and good luck in your applications.